Hello, my name is Kelly Edwards, and I am interviewing for the Program Management Consultant position. As I've been informed, Mobiland Health Centers are looking to implement a mobile health application to improve health service delivery, particularly to improve referrals of patients between hospitals. I've been informed that there are current problems with communication between the community, district, and regional hospitals in Mobiland. The Ministry of Health, along with myself, believe that a mobile health intervention would greatly benefit the Mobiland healthcare system. As the program management consultant, I would be able to provide the following deliverables for MACOM to implement a successful pilot test of the chosen mHealth application. The first deliverable is an environmental scan of current problems, key players, and areas of improvement, which will give a better understanding of the existing ecosystem of the Mobiland hospitals. The first part of this deliverable will be a process map of the current referral process, including descriptions of how communication happens between hospitals. The second part of this deliverable will be the defining and measuring of baseline indicators. The quantitative indicators include number of referrals, of that, the number of referrals that were completed and the number of referrals that were lost, and the time between referrals measured by days between appointments. The qualitative indicators include ratings and comments from both the physicians and patients at the hospital. Using these measurement indicators to collect baseline data on how each department is performing, specifically in regards to the referral process, we will be able to have a thorough understanding of what problems are occurring, and using the process map, we will be able to pinpoint weaknesses within the pathway. This would involve project staff spending time at all 3 hospitals, tracking appointments and following up with patients via surveys, and having informational interviews with the various healthcare staff. The second deliverable is recommendations for specific mHealth platforms, including detailed explanations of why they are being recommended and exactly how they will meet the needs of the Mobiland healthcare centers. The deliverable will also include expected costs of the mHealth application. Even though the Ministry of Health is providing Androids, the cost of the mobile app software is a factor to consider, especially depending on how many people will be using it. As noted, a large percentage of the Mobiland population already have cell phones. This is key because it will make the implementation of the intervention easier if those using it are already familiar with how to use smartphones. Strictly based off the information I was given, the mHealth applications Magpie and ComCare come to mind as potential applications that could meet the needs listed. Both applications provide the following uses: easier management of patient info while maintaining confidentiality, improvement of communication and enhancement of the integration of healthcare processes, questionnaires and forms that can be designed to be exactly what the healthcare staff needs, and instant communication between users, allowing for quick and easy referrals. The second deliverable will provide even more detail on the pros and cons of all recommended mHealth applications. Keep in mind that the environmental scan will allow for a better understanding of the problems occurring and therefore will allow me to make a more detailed and confident recommendation. The third deliverable would be the implementation plan. Having an mHealth intervention will be very useful and will provide positive results. However, many things need to happen for the pilot test to be successful. The first step of the implementation plan is getting all key players and healthcare personnel on board with the pilot test. A major potential roadblock of implementation is staff not wanting to make this change. So, it is very important that healthcare personnel are involved in the process and they feel like the intervention is benefiting them more than it is frustrating them, aka not adding more to their plate but making their jobs easier in the long run. In order to address this roadblock, I have a few ideas. I believe it is critical to inform personnel in advance that the intervention is coming and why. It is important to emphasize that the goal is to improve health services and improve the system for everyone. Additionally, it is critical to collaborate with the staff that will be using the mHealth application to design the forms within the app that they will be using to best match their routine. The idea is for staff to use the app to record patient info, so we want them to want to use it. By collaborating with them and designing it to best fit their needs while also meeting needs of MACOM, the intervention is more likely to be implemented without pushback. Finally, it is important for project staff and supervisors to listen to any feedback and complaints from the healthcare personnel and take them into consideration. The second step of the implementation plan is training the healthcare personnel. The training portion includes the timeline of getting the pilot test in motion, the delivery of a training manual for the chosen mHealth application, which I will touch on more later, and providing a hands-on opportunity for the staff to test out the application and provide feedback and questions to the project staff. The third and final step of the implementation plan is launching the pilot test itself and performing monitoring and evaluation. I believe it is best to start the pilot test off on a small scale, for example, starting with a specific department, such as the OB/GYN department at each hospital. That way, we will be able to monitor, record changes, and get feedback easier. The pilot test would be for a designated period of time, and the specific department would use the mHealth app while we continue to measure the previously designated indicators. Doing so will allow us to compare changes from the baseline data of that department, and we will be able to assess if the application is effective by looking at our measurements of success. An increase in the number of referrals overall, a decrease in the number of lost referrals, and a decrease in the time between referrals. The idea would be to continue to evaluate and make improvements to the mHealth intervention before spreading it to other departments. The final deliverable, which is a part of the implementation plan, is the training manual. This would be in the form of handouts and PowerPoints given to personnel by their supervisors and the project staff who would be available to provide support at the trainings. The manual would include detailed instructions on the following: how to install, how to use forms within the app, how to refer patients between hospitals, how to solve common problems, and who to contact if other problems occur. Lastly, as the program manager consultant, here are 2 challenges that may come up and how I would address them. The first is behavior change difficulties, meaning the difficulty in getting people to change their routine. To address this, I suggest a few things, including incentives, a buddy system of keeping one another accountable, a designated team lead to promote app usage, and emphasizing the role of the supervisor in motivating employees to participate. The second is the inevitable technology problems that come with using an mHealth intervention. In order to alleviate this, I suggest either having a project team member be available for assistance 24/7 or train the hospital tech assistants to assist with the app problems. I also think it is crucial to have backup phones in all locations in case of emergency tech problems. Finally, as the program management consultant, I believe I'd be most useful on location at the hospitals in Mobileland, going between the 3 locations for the duration of the pilot test. That way, I would be able to work with our staff and the healthcare personnel to mitigate any additional problems that may occur. With the proposed deliverables, I believe that MACOM will be able to have very successful pilot tests in Mobileland with their first mobile health application, and it would provide a great first step towards integrating mHealth into the continuum of care. Thank you for your consideration, and I am very grateful for the opportunity to get to work on this project with MACOM.